Good evening, everyone. My name is Joanne Marr, and I'm the President and CEO of Oak Valley Health, which includes our Markham, Stouffville, and Uxbridge hospitals. And I thank you for joining our virtual community town hall this evening. I'd like to open our session with Oak Valley Health's land acknowledgement. Oak Valley Health honors the traditional territory of the closest Indigenous communities, the Chippewas of Georgina Island and the Mississaugas of Scugog Island. The Haudenosaunee and the Anishinaabe have lived, worked, and existed on this land from time immemorial. This land is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty, signed with many Mississauga and Chippewa bands. We acknowledge that Indigenous peoples were not asked to share their territory with settler populations, and that we are all here as uninvited guests. We acknowledge and thank all generations of Indigenous peoples across Turtle Island for their commitment, contributions, and protection of the land and its resources. Now I'll share a bit more about what we're planning to cover this evening. I'll share an update on the pandemic's impact on our health services and where we go from here. Then our VP of Planning and Transformation, Elena Pacheco, will share more about future capital redevelopment plans for our Markham, Stouffville Hospital and Uxbridge Hospital sites. Then we'll have time during the second half of our hour to answer questions that you'll have for us. And you'll be able to submit those by typing your question in the Q&A box that should appear at the bottom of your screen. Now it's my pleasure to welcome His Worship Dave Barton, the Mayor of Uxbridge. Mayor Barton has been working closely with us on our redevelopment plans for the Uxbridge Hospital, and he wanted to share a few words this evening. Welcome, Mayor Barton.
Well, it is fantastic to be here tonight. I really enjoy working with Elena and yourself, Joanne. Just an incredible team as we work through the redevelopment of the Uxbridge site. We obviously communicated a lot during the first couple of years of the pandemic. At times sort of daily calls as we work through some issues. And again, you've been incredible team members. To watch you professionally manage this pandemic was phenomenal. And again, really proud to work with you, proud to be friends, and really exciting for what will be happening in the next year or so. And then also like to thank Uxbridge Township staff and council for their support as we work through this. And also special thanks go out to our MPP, Peter Bethenfalvey, who has been an excellent partner through this process. And again, we hope to see lots of additional good news coming soon.
Thank you, Mayor Barton, for joining us this evening and for your ongoing support. Uxbridge is a very special community that we are so proud to serve. Peter Bethenfalvey, Minister of Finance and MPP for Pickering Uxbridge, who Mayor Barton just referenced, also wanted to join us this evening, but was unable to attend. But however, he did send video greetings for us to share on his behalf.
Good evening. As the Member of Provincial Parliament for Pickering Uxbridge, I've witnessed the tremendous impact the clinic staff and the leadership of Oak Valley Health have had and continue to do so on the lives of so many individuals and families in Uxbridge and across Durham region. The Oak Valley Health Uxbridge site is a critical part of our community. In order for our healthcare professionals to continue to provide extraordinary care, we need to ensure that we engage with our local community and get your feedback. I would like to wish the hosts, Elena Pacheco and Joanne Marr, along with the rest of the Oak Valley Health team, the best for a productive virtual community town hall.
Thank you, Minister Bethenfalvey. We very much appreciate those sentiments, as well as your ongoing support for Oak Valley Health, as well as our redevelopment plans for the Uxbridge Hospital. Now I'll shift our focus to the pandemic update. Last month marked 2 years since the WHO, the World Health Organization, declared a global pandemic. And to say the last 2 years have been a difficult time for our organization and our community we care for would be an understatement. While the strain has been tremendous, we've seen firsthand how our healthcare workers in our community and beyond have given so much to protect all of us. Throughout the hospital's response to COVID-19, the focus has always been on the safety of our staff, professional staff, and our volunteers, as well as the patients and families we care for. While we're certainly not back to pre-COVID times and the pandemic is not over, we're turning our attention to what lies ahead, that is implementing a COVID recovery strategy. Having said that, as a healthcare organization, we have a responsibility to go beyond the minimum public health requirements for the general population in order to keep our patients as safe as possible. We'll continue to take a purposeful, measured approach to our activities, prioritizing the safety, health, and wellness of our patients, our staff, and our professional staff. Despite the Ontario government's lifting of the vaccine and masking mandates across Ontario in settings such as retail, gyms, restaurants, and others, we will require that masks continue to be worn inside the hospital. And consistent with many hospitals across the province, we continue to ask for proof of vaccination from our visitors. This will ensure that we maintain the safest possible environment for our patients to receive care at Oak Valley Health. We care for some of the most vulnerable members of our community, and it's our responsibility to take every possible measure to protect them. We also have a duty to create a safe environment for all of our staff, professional staff, volunteers, and learners. We'll continue to monitor the circumstances in the community, and we'll review the proof of vaccination requirement and a broader visitor policy on an ongoing basis, rest assured. Vaccinations have played a key role in slowing down COVID-19 and protecting our community, and they remain an important tool for all of us to use. Throughout the pandemic, our vaccination efforts, in partnership with York Region Public Health and the Eastern York Region, North Durham, Ontario Health Team, and the City of Markham, supported the delivery of over 270,000 vaccine doses. Because of the significant increase in the percentage of vaccinated community members, we've now closed our mass vaccination center at the Cornell Community Center. We've resumed elective and non-urgent surgeries and procedures that were delayed during previous waves of the pandemic. While our surgical team did an incredible job of prioritizing care for the sickest patients during the latest wave, they're working hard to catch up on the elective and non-urgent surgeries and procedures, especially those who've been waiting the longest, but understand that it will take some time. Another key area we're excited to move forward with as we look to pandemic recovery is our capital planning efforts, looking at how we'll continue to meet the growing needs of the communities surrounding our Markham and Uxbridge sites. And on that note, I'll now turn it over to Elena Pacheco, our Vice President of Planning and Transformation, for more on our redevelopment plans. Over to you, Elena.
Thank you, Joanne, and good evening, everyone. I'm actually going to use some slides for this portion of our update so we can visually identify some of the locations I'll be speaking to. I'd like to begin with the latest on our Uxbridge site. In November 2021, we celebrated another important milestone for our organization and communities in Uxbridge and Durham region. In partnership with Uxbridge Health Center's physician group and Oak Valley Health, we officially announced the opening of Oak Tree Medical Center in November and our first phase of the redevelopment at the Uxbridge site. Quite the milestone. Having the ambulatory building in close proximity to the hospital allows the physicians who work in the family practice, as well as in our emergency department and inpatient units at the Uxbridge Hospital, to practice more seamlessly, train, and collaborate with one another. This is a significant step in the right direction. As services transition into Oak Tree Medical Center, we submitted our Uxbridge Hospital expansion proposal to the Ministry of Health and Ontario Health. This is also referred to as a Stage 2 planning submission. The plan for the new Uxbridge Hospital is to build on existing land And once complete, it'll be a brand new state-of-the-art where patients will receive an extraordinary patient experience and continue to receive the highest quality care. Additionally, we are proposing there be a third building on the Uxbridge Hospital property, a long-term care home with seamless connection to the hospital. We also know we're seeing higher volumes and sicker patients in our medicine program, and we continue to exceed our current capacity. As part of our potential partnership with long-term care, we're exploring options to help build additional capacity at the Markham site. It's important to note that we're still awaiting government approval to move forward on the next steps. And we are committed to keeping our community informed and engaged all along the way. I'd now like to shift our focus to the Markham site. In 2013, the organization opened its doors to a newly expanded Markham Stouffville Hospital, featuring a unique development having the hospital connected to the Cornell Community Center and local library. That expansion offered the capacity of more emergency and ambulatory clinic visits and an increased number of hospital beds by growing and expanding the emergency department, improved and expanded ambulatory clinics, more inpatient beds and operating rooms, new diagnostic imaging department, new childbirth and child services area, and a new mental health unit. Now it's time to start planning again to meet the current and future needs of our growing community. We've been reviewing our physical spaces and analyzing the demographics and growth in the surrounding communities we serve. We focus on the needs of our evolving community to see where and how our community is growing and what programs and services we will need. Our new master plan sets out how we will operate and shape the future of care over the next 15 years, with the ultimate goal of being a health system leader and trusted partner in our community. Oak Valley Health's vision of caring beyond our walls is put into action each and every day and guides us through the planning process. The new plan is also a commitment to focus on full health experience of patients and families, from how and when they access our services, to the holistic care we provide, to support they receive returning home to the community. From our clinical services plan, which is a comprehensive plan outlining our current and possible future programs, service volumes, and physical space requirements, we then commence the master planning process. That planning details where the services will be located on the campus and sites for future buildings. At the Markham site, we are in the very early stages of planning, a phased master plan approach, exploring the build of an ambulatory care building and expansion of support services in our first phase. In these early stages, we still have a great deal of engagement and planning work to do with our staff, professional staff, and community. But we did want to share some potential areas for expansion of our space and our current site based on our clinical service plan work. It's also important to note that planning and government approval could take years before any construction would begin. A new ambulatory building could incorporate the majority of your ambulatory clinics and expansion of future clinics, as well as a learning center and administration spaces. The future ambulatory building would have several floors and could be located where the current administration space is situated, circled on this map. At the same time, in the first phase, we're looking at a planned expansion of the support services and shipping and receiving area, with additional loading docks circled in red here. These areas manage things like the provision and delivery of patient food, receiving shipments of material and equipment, and the management of supplies and equipment for areas throughout the building, including linens, surgical tools, and so much more that directly supports the delivery of patient care. During the last build and expansion before the 2013 opening, support services and the shipping and receiving areas were not expanded nor renovated, and the majority of the spaces in these areas is the original build from the 80s. The proposed phase following that redevelopment could include a future tower, expanding our existing programs and services, as well as growing future programs. That's circled in red on this slide here. In that phase, we envision the expansion of the emergency department, surgical services, the medicine programs, including critical care and clinical support areas. Again, still lots of planning and engagement to come on that. As part of our clinical services planning mentioned earlier, a hospice was identified as a need in our community, and we have identified available property at our Markham site, circled in red here. Oak Valley Health currently supports palliative care programming, including inpatient beds. However, we recognize that while some patients require hospitalization, a majority of patients and families prefer care at home or in a hospice. So we've begun discussions with community partners, SC Health, formerly St. Elizabeth, and Evergreen Hospice on a potential collaboration. The three parties have agreed in principle that we have the ingredients for a successful partnership and should move forward in supporting this project. We hope to share more on that partnership and future build of the hospice once we finalize the plans. With respect to all of these updates I've shared with you, I'd like to thank all of the clinical teams involved in the planning to date, as well as our planning department and architects. And thank you for your time on this update today, as we look forward to your questions, ideas, and comments you may have. Thank you, Joanne.
Thank you, Elena. I know that a great deal of effort has gone into this planning effort already, and it's terrific to see this for both our Markham and Uxbridge sites. I think this is also a good time to mention that Oak Valley Health relies on donor support to fund state-of-the-art equipment, technology, and the expansions we need to deliver the highest quality care. The continued support of our community will help to transform our hospitals into an integrated healthcare hub with enhanced services, expanded spaces, and the best talent to become the hospital we need and that we aspire to be. With you by our side, our community can count on us to deliver a lifetime of care closer to home for generations to come. On that, I'd now like to turn the virtual microphone over to our community so we can address the questions that you have for us. Again, just please type your question in the Q&A box that should appear at the bottom of your screen. And so we will move to Courtney to advise us of questions that we have coming in.
Okay, great. Thank you, Joanne. And just for anyone who may have raised their hand, I know that that function is enabled on the current platform we're on. If you could please just type your question into the Q&A. We can't actually call on participants who've raised hands. So if you do have a question you'd like to ask or even a comment you'd like to share, we're going to be continuing to track all of those and collate them with all of the feedback from this evening. So please do go ahead, as Joanne mentioned, and put it in that Q&A box on your Zoom screen. So I guess maybe we'll start then, Joanne, with a few questions about the pandemic, maybe just circling back to your initial remarks and just any commentary or anything you can say about a potential sixth wave that may be happening right now.
So thanks, Courtney. We are officially in a sixth wave. You know, how serious that's going to be remains to be seen. Certainly at the hospital levels, we are seeing an increased COVID burden, though certainly not as extensive, at least in our facility, as it has been in previous waves. Nevertheless, as I mentioned in my earlier remarks, the pandemic is not over. In fact, there's quite significant spread in the community at this juncture. I'm sure many of you know many people who have either been in contact with or have contracted COVID. So just to reiterate my comments, I think that's why we are maintaining our vaccination mandates for visitors, as well as requiring mask use in the hospital. And we would urge you in the community to maintain the public health measures that we know are very helpful in the fight against COVID. So of course, hand washing, physical distancing, the wearing of masks, and you know, avoiding contact with anybody who's potentially suspected. So again, you know, bear with us and help us in the fight. And of course, I didn't mention vaccination, but vaccination remains one of the key tools. So encourage your family members, friends, others, neighbors to please make sure that they have all the doses of vaccination that they can get access to. Very important.
So on that, good segue, Joanne, to the next question. If any of our community members have a family member or a friend that's concerned about the vaccine, still not comfortable, worried about it being harmful, what advice would you give to them?
So, I mean, we have good information on our website. You can listen to talks by Dr. Anthony Ladelfa, who's our infection prevention and control and lead. But he would tell you, and I think many of the public health experts would say that while there have been issues noted, by and large, the vaccines have shown and been demonstrated to be extremely safe, and the risks certainly of not getting vaccinated are significantly greater. So we would encourage people to talk to their family physicians or other healthcare professionals if they have specific concerns and questions.
Okay, great. Another question on the pandemic then, Joanne, in terms of your point about the backlog of surgeries, what kind of time frame are you anticipating for catching up on those?
That's a great question, Courtney. I think that a question that everyone is asking us. We're working very hard. Soon we'll be close to full capacity. We're probably about 90% capacity. And again, the team is very much focused on those who have been waiting the longest, as well as those who have the greatest or most urgent needs. And I think we'll be in a much better place by end of the year. I can't tell you exactly when all of that backlog will be cleared, because of course, as you will be very well aware, that many people waited for a very long time, and those wait lists build day over day. Be patient, and your clinicians will move you ahead if you are waiting, but certainly don't hesitate to reach out, and someone will be, I think, pleased in your physician office to help you understand where you fit in the queue.
And then, Joanne, we've got a great question from the community about Cornell. I know you touched on it now being closed after the over 270,000 vaccines administered, but is there a plan to reopen it for the 4th dose as that extends to a larger population? I think the announcement came 60 plus as of tomorrow, but are there plans to reopen that? Yeah,
that's a great question, Courtney. So we won't be opening Cornell. We have been so fortunate to work in partnership with the OHT, and as I mentioned, the city of Markham, to have access to Cornell. It's a very large venue, central in the community, that allowed us to very efficiently deliver a large number of vaccine doses on a daily basis. But because of the reduced numbers, and because, of course, the community really needed access to the community center, that was important. We made that decision together to hand it back to the city. There are many other venues to receive the vaccine in the community, across the community, through public health and other venues. And should we need to schedule pop-up clinics in partnership with the OHT again, we will absolutely consider that, but there isn't a plan to offer a clinic at this time.
Okay, great. And maybe before we shift to some of the master planning questions, Joanna, a question just about the rebrand. So regarding the Oak Valley Health rebranding, how was this change accepted by the community, and have all signage and transitions been completed already?
So that's a great question. We moved to, as you heard, and many of you will know because you were involved in the engagement process, Oak Valley Health as a name that covers both campuses and other locations of the hospital as a corporation. And that was really important for us to support our new vision, and also to significantly bring the Uxbridge Hospital into the fold, so to speak, into the family. The rebranding efforts were slowed down, and the signage related, which is an important part of that, has been slowed because of the pandemic. And we chose to move slowly and thoughtfully as we moved forward with that process because of the pandemic, because obviously changing signage, changing naming is probably not best done in the midst of, a public health crisis. However, we are moving forward. Much of our signage did need to be changed and updated after the redevelopment, and we did put that on hold because we knew we were in the process of rebranding. There was a significant amount of engagement, certainly across our hospital communities. And we actually engaged with our President's Advisory Council and other stakeholders who gave us, I think, very helpful suggestions about the process, and also rang in on the ultimate name that we chose.
Okay, great. So I think we can shift to a few questions we've got coming in around the redevelopment plan. So Elena, just quickly, if you could just circle back on how people can stay informed about the redevelopment plans for Uxbridge.
Yes, there will be definitely different pathways to stay informed. Our website being one, and we plan on doing more community engagement. So we will be out in the Uxbridge community engaging on the redevelopment, as well as we progress here at the Markham site, we will be updating the community as well and engaging.
And also on that, Elena, a question just about how long will it take to redevelop the Uxbridge site? So maybe more on the timing for that process.
Yeah, so as mentioned, we don't have approval to move into our implementation stage, which really gets us to our next stage of issuing an RFP, landing on a developer and starting construction. We hope to receive an announcement soon, and if that does happen, we're hoping shovel in the ground in about 1.5 years.
Okay, great. And then just more on that about the kind of support you've received and where you're at in the process in terms of the Uxbridge approval for the plans.
Yep, so we're currently in stage 2, and we have submitted that back to the ministry and Ontario Health. We have received feedback and have answered all their questions. So we really are hoping that we will move on to the next stage, which really is our implementation stage.
Okay, great. And then here's a question I know I've heard that you get when you're also out in the Uxbridge community quite a bit. Will there be an MRI at Uxbridge or any other new DI services?
That's a great question, Courtney. We did actually put in an application for an MRI at the Uxbridge site, and I know the Uxbridge community would be thrilled to hear that. And we are awaiting feedback, so it was just an application. We do have some plans for where we would put it in our ambulatory building, and we're awaiting to hear back from Ontario Health.
Okay, great. And then also, I believe this one is for Uxbridge. Does the hospital own the land for the expansion? So the planned expansion?
We do. So we own the land here at the Markham site and at the Uxbridge site. We have approximately 15 acres at the Uxbridge site, although all of it's not usable. So it really will be a seamless campus as we move forward. I touched on the long-term care home, and I touched on the rebuild of the hospital along with the current ambulatory building. So there will be interconnection with all three. And then once those are built, we would actually knock down the old hospital and redevelop that area into additional parking. So it will be a phased approach as we move through the process at the Uxbridge site.
And I'll just add, Courtney, we are so fortunate as an organization to have so much land. In fact, many hospitals don't have that asset, and it's something that we should be very positive about for future redevelopment.
So on future redevelopment, we've got a question just on the Markham site then. What is the expected timeline for the redevelopment of the Markham site? I know you touched on that a little bit, Elena, if you could walk us through it.
So again, we're in the very early stages at the Markham site. We just completed our clinical services plan. And as I had mentioned, it really touches on our demographics, our growth in the area, services that we want to provide in the future. Those clinical services plan really informs what the master programming and the master plan will look like in the future. We will be doing internal engagement, which is very important. Currently, we just cited the buildings based on the clinical services plan. So what that really tells us is, do we have enough space on the site to build for future buildings? And the answer is yes, and you've got a glimpse of that in some of the renderings today. So we will be doing some internal engagement. really refining what that master plan will look like from a siting perspective, a service perspective, a flow perspective. It's really important that we thoughtfully think through how services will be accessed and where, including a new ambulatory building. As we start to embark on this, it will be the same ministry process that we used at the Uxbridge site. We would be submitting a stage 1, and we would have to go through the 5 stages. Typically, this takes years to come to fruition. So we could be looking at 10 years of planning before we actually get construction here at the Markham site for an expansion or tower. However, we do want to accelerate our ambulatory building. And that is something we are talking to the ministry with as a first phase, as touched on the diagrams, as well as an expansion of our older support services areas, because again, they were not redeveloped in the first wave.
Okay, great. And then just, I know you mentioned community engagement and obviously engagement with staff and professional staff. Can you touch on just how patients are also involved when you're looking at space and redevelopment of space?
Yep, so we do actually bring in the community, again, as we work through flow, Courtney, how patients would enter, all of that engagement happens. We actually tap on some of the members that we have today from the community to help us through redevelopment projects, and they would be involved in part of that planning as well.
And as I referenced earlier, we do have a President's Advisory Council and other subgroups associated with that, and that would be another venue. And, events such as this, which we will have more of in the future, could provide an additional opportunity.
And that's a great point as well, Joanne. So I know we've had some comments come in of just people saying hello and good evening, but if you have anything that you'd like to add in that chat, maybe not a question necessarily, but even some feedback you'd like to give us on what future sessions, what you would like to see in future sessions. We'll also be circling back after this meeting with a follow-up email, sharing the link of the session if you'd like to rewatch it, and also giving you an opportunity there. And there was an email in the invitation as well that you can send that information into. So just circling back then a little bit on the pandemic, Joanne, and your reference earlier in the presentation or comments around Care Beyond Our Walls, and would you be able to touch a little bit on what some of that work looked like throughout the pandemic with our community partners and our surrounding communities?
Sure, great question, Courtney. And we often talk about how we really didn't anticipate that our vision would truly come to life, and that is Care Beyond Our Walls. We anticipated working beyond our walls and out in the community, because absolutely, as important as the hospitals are, really a lot of care is delivered in the community, and that's certainly the future. And integration with the community and other partners has definitely been something in healthcare we've been talking about for many, many years. But because of the need, we were involved in early days setting up a COVID assessment center, and that continues today. We talked about the vaccination clinic. We were very involved in supporting long-term care, retirement, and other congregate living spaces by dispatching our outreach teams and setting up an IFPAC, an infection prevention and control hub, so that we could support others out in the community, including primary care providers, to keep people safe in their homes, wherever their homes were, home, retirement home, long-term care, that's all people's homes. We also provided operational oversight, as did many other hospitals in the province and beyond, for a long-term care facility outside of our region. So we were very much involved in partnership with primary care and the Ontario Health Team in providing care to the community. Many of these activities are typically the domain of public health or another ministry, but I think it speaks to our vision of Care Beyond Our Walls, communicating and coordinating with our community. And that's in fact what we did, always in partnership and very much in collaboration with public health, who really are the content experts in managing through a pandemic.
So just shifting back a bit, and we'll do that as these questions come in on different topics, but looking back to Uxbridge, Just some questions here around, will there be hospice facilities incorporated into the new Uxbridge campus? Maybe Elena, if you want to take that first, and then if Joanne, if you want to add to that.
Yep, so currently, we are looking at a partnership in the long-term care home and building additional capacity at the LTC home to look at hospice, so it would be palliative care, complex continuing care, some of our post-acute, but we don't have an official partnership on that site. But I do know that there is a partnership in Uxbridge, and I don't know if Dave wants to chime in on that piece.
Sure, thank you very much, Elena. We are also partners with the Oak Ridges site in Port Perry. So they recently put that site together, and we were a funding partner as well as partners through the region of Durham.
And I'll just add, and Elena mentioned this, we do have plans for a residential hospice on the Markham site. As you heard, hospice, there are plans for hospice in the Durham region. And so that's not to say that that couldn't become part of our future plan, which is why these kinds of engagement opportunities are so important and must continue. But certainly palliative care, whether it's home-based or institution-based, will definitely be part of our clinical service plan.
Okay, great. Just a question, Elena, then about the services in the ambulatory building that recently opened in Uxbridge. Can you touch on that again, just about what services are in that facility, that building?
Yeah, so we're finalizing the services for the ambulatory building. Although it's built, the space in the ambulatory building is shelved space currently. We're working again through the clinical services plan and through the ministry funding to get those spaces up and running. There would be diagnostic services in there as well as all of our ambulatory clinics. And we're looking at an expansion of our ambulatory services in the Uxbridge catchment area and really looking at how we utilize virtual care through the Markham site to really expand services over there. So as we finalize those plans, we will share those details.
Okay, great. And another good program planning question. How do you plan to incorporate the needs of a culturally diverse population and seniors into our community, to your clinical program planning? Do you want to start that, Joanne, and then maybe if Elena wants to add to it?
Yeah, sure. So we do have, as part of our clinical service plan, plans around seniors care and geriatrics. We also have, as part of our vision on campus, seniors living, independent living. We have long-term care already. We have plans for more, as you heard, supported and assisted living, and that would be aligned with our Ontario Health Team work. So absolutely, that's part of the future plan. But I know Elena will have some thoughts to add.
Yeah, and just to add to that, Joanne, really important with the Ontario Health Team. We have many partners that sit in our Ontario Health Team, over 21 partners, including York Region. We do a lot of work on seniors programming with York Region. We know that there is a big need in terms of LTC, as well as culturally diverse independent living. And as Joanne mentioned, we do have 50 acres here at the site. And we are looking at how do we build that in, or how do we partner with culturally diverse partnerships to really look at independent living or expanded LTC. So as we, again, progress through our CSP, our clinical services plan, we will be sharing that information.
And I'm sure, Courtney, you might have some comments to share, given the work that you've done on our enhanced community engagement plan, part of which targets culturally diverse communities and focusing on those specific needs.
Yeah, and that's actually where I think we've also been able to identify that there's a gap between our culturally diverse community even knowing the services we have here and what's available. So there's been work to both incorporate and engage in the planning, but also in making sure our community is aware of the services. For example, a lot of work that the hospital has made a strategic priority around language navigation, and how we have been working to make medical interpretation and translation a priority. And so we do have a program for on-site in-person medical interpreters, and they have been deployed throughout the hospital. And we've received great feedback from both patients and our staff and professional staff on how that has led to better quality outcomes and a better patient experience. And we've got Great progress on that we're looking to for the next year as well, looking at real-time video conferencing and other services. So if you do follow some of the communication vehicles that we have, you'll see some of that, but we are also exploring better ways to reach our diverse community that maybe we haven't been able to reach out to before. So yeah, that is definitely a priority, and I think we've made some good progress, and it continues. So I guess that wraps up that question. I think we were going to maybe loop back to some pieces on pandemic, because I know, Joanne, you also wanted to share the video, that maybe before we do that, it's a corporate video that Joanne's going to introduce. We did have our very favorite question about when this pandemic will be over. I know we hear that a lot internally, and you touched on how hard it is to predict, but is there anything you'd like to add to that?
Yeah, it's a great question, Courtney. We hear it every day. And so, in short, no, the pandemic's not over, although, we know the things are improving, and the community has started to open up. But again, I would reiterate, it's not over. And so you will see more restrictions in settings like long-term care and hospitals for all the reasons I mentioned earlier. And so we would just urge people to, continue to follow public health measures to keep yourself safe, your family members, and understand that that's an important part of our role. So we will have more stringent measures. Now, here's hoping in the future that this pandemic will become endemic, but no one knows when that will be.
Okay, great. So if there are any other questions or comments, we've got our Q&A box open. Again, it's on your screen. You can go ahead and put something in anonymously, or you can ask something with your name. And if not, we've left a lot of time here for the Q&A. So if that portion's wrapped up, we'll be able to move over to the video that Joanne wanted to share and then wrap things up. And there's always an opportunity to share information and some of the other ways that we already talked about, including the email that was included in your invitation to the Zoom meeting tonight. So maybe I'll turn it over to you, Joanne, just to say a few more words before you introduce the video.
Sure, and you can certainly send in your questions. If you want to stay connected with our updates, you can visit our website. You'll find more information on how to stay connected with us. You can subscribe to our bi-monthly newsletter called The Link, and other platforms like social media. And of course, as we mentioned, community meetings like this one, and we hope to have many more based on your feedback. We can tailor those to best meet your needs. So the video that Courtney referenced, our staff created this video last month to mark the 2-year milestone of the pandemic. And it gives you a small glimpse into what some of our staff and our professional staff have learned as they work to keep our patients, families, and community safe. And I will say, and I'm sure you'll find this too, when I watch the video each time, I really feel a strong sense of pride. So I hope you like it.
I've learned that COVID is a really brutal virus. From the early days when we would scope patients in the ICU, that it wasn't just a virus that affected the lungs. We could see it in the lining of the stomach and into the intestines. It brought together some teamwork. During wave, I guess at 4 it was, I was redeployed to the ICU overflow unit, which was really an eye-opener. But it was really nice to see the camaraderie amongst the other redeployed staff.
I've learned that this virus can change and change quickly. As you've seen with 5 pandemic waves, it can really come hard and come fast. And when it does, I'm very grateful that the team here at Oak Valley Health and everyone involved steps up like never before.
Vaccinations work. Right when the vaccinations rolled out, we saw a huge decline in cases and people coming in, and they're coming in with less severe cases. So
I learned that little things in life was very important, such as going out with friends, seeing people, going out to eat, having potlucks in the department. The past 2 years made me realize how much I really missed doing things like that.
I really appreciate the way that everyone works here as a group, like in a team, and we make their days better for them and better for us too.
I think these past 2 years working in ICU, I've learned how much teamwork goes into looking after our patients and how much the rest of the hospital jumped in to help us throughout multiple waves of COVID.
So I've learned to be self-sufficient, being able to do a lot of things that used to depend on other people by myself. After I kind of got to know that, I realized how important it is to have a social network and be interdependent, because I do feel like when we're together, we achieve more than I could ever do by myself.
We all have learned to live differently. We were forced to work in a different work schedules. Many of us has learned to deal with our stresses differently.
Even though the pandemic was a really challenging time, it also really taught me to advocate for my profession. As a therapeutic recreation specialist, we try not to just look at the medical side of things, but really focus on the person's emotional well-being and social connections.
I've learned how important your wellness is as a whole and how important it is to keep everything together. So your social wellness, your occupational wellness, your mental health, your physical wellness.
Say as an IT group, we learn how to change and adapt as fast as we can.
The past 2 years have been a real test for all of us, both personally and professionally. I joined the hospital during this time to support our teams during the pandemic, and I'm really proud of the work we've done in patient advocacy and providing safer, more equitable care. Many of us have also gotten really close during this time, and I can't wait for this all to be over so we can celebrate together.
Sanitize your hands, wear a mask and distance.
I've learned to never give up and tell our loved ones how much we love them. I also learned how important this hospital is to our community.
I've learned that the world has come together in unity. We are all combined, we are all doing the same thing, same purpose, be safe, and keep on going forward.
What I've learned is that the disproportionate effect of the pandemic on the marginalized and racialized groups in our country will have a fallout for a long time to come. So I think what we can learn is that the best way to move forward is to find common ground, and that equity, diversity, inclusion really is not optics. It is probably the best way for us to become stronger together after this pandemic.
I've learned how important it is to maintain our humanity and our humility. These past few years have taught me to hold tight to the ones I love and to those who make me feel good. And last of all, I've learned just how strong and brave our frontline workers really are.